Dr. Brady, you've spent your entire career in the public sector, including 7 years as a physician in the U.S. Navy. What strategies should the private sector consider implementing?
Well, that's great. I mean, I think, one that comes to mind that I think is also kind of aligned with the thinking that's in the National Action Plan in terms of trying to highlight broad foundational factors that have the potential to help solve a lot of problems. They are part of the solution, in several different categories. And I think teamwork is one of those. We've seen consistently from research that healthcare is safer when it's delivered by teams who are engaged and empowered, working, in concert on behalf of the patient. So this, I kind of see this aligned also with the collaboration that we're trying to bring about, the increased collaboration with the National Action Plan. But here we're really talking about teamwork at points of care where it's just that's how care happens now. It's kind of like, no individual organization is responsible for safety. It's rare that you have care that's delivered where, an individual provider has sole responsibility, and there's, dependence on other team members. And I think the realization of that in the field pushed AHRQ to develop this tool, Team Steps, and that's I think one of our big contributions. We worked with the Department of Defense in the development of that. And basically, I think, it's such a commonly known tool now, but for those who don't know about it, it's a training curriculum that applies different approaches to teamwork that are used by the military and other organizations, but the military in particular. And it focuses on communication standards and making sure that there are clear roles, in the healthcare team, that, one team member knows clearly what another is doing, and how their work relates to each other. And it's not only about clear communication, but efficient communication too. That's important. There's a lot to be done in healthcare, and we don't have a lot of extra space and extra resources to waste time and energy. So I think that's at the heart of it too, is clear, safe communication. And then I think the final thing that is so important, and this is true, I think, more broadly throughout patient safety work, is that, every member of the team, every stakeholder, how can you work to make sure that their voices are heard, including the patients, probably the most important member of the team. And so I think not just talking about that, but making sure that people know how to do it, I think, and that's what a lot of these resources do. So let me stop there. Tejal may have some other thoughts about, things that have, adoption of different practices that have helped, to promote safety more broadly.
Well, I think you answered the question pretty comprehensively, Jeff. And I mean, I think the teamwork piece and sort of a lot of the cultural interventions, of which teamwork I think is one, but thinking about psychological safety to speak up, thinking about visible leadership commitment to safety with things like rounding. Those are all things that I think have been some of those things that have contributed to this and sort of worked together synergistically to make the advancements in culture that we've started to see, at least.
Mm-hmm.
Yeah, the final quick thing I would add to that, it's a great point, is, there are a lot more standards for care delivery that are specifically focused on ensuring safety. So I think that's what, not all, but a lot of the work has been about in the safety field over the last 20 years, is sort of, finding out, developing, testing, evaluating those standards, and then this last important step, which is to integrate them thoughtfully into practice, not just kind of drop them into the clinical environment and expect that they're going to be automatically implemented without, hard work. And so, we've got resources, that have reviewed the evidence, things like AHRQ's Making Healthcare Safer series, which looks at, different evidence reviews for patient safety practices. That's just one example. But I think that standardization and, again, collaboration and development of those kinds of practices, I think, has been a really big contribution that many in the field have made.
Mhm. Absolutely. Dr. Gandhi, some of your research focuses on international patient safety. Is global too large of a scale to affect change and each country too diverse? Or are there areas where every country can and should focus to raise all boats?
I think that there are universal foundations to patient safety that we focused on in our national action plan that are actually relevant no matter what the context or geography. And, as we even have done work internationally and collaborated with folks internationally, for example, with the World Health Organization, who's working on a global patient safety action plan, it's very interesting because they were working on their plan and we were working on ours in the United States, and yet the crosswalk there was incredible. The vast majority of things that we were talking about in our U.S. plan, they were thinking about globally in their World Health Organization plan. And I think that just gets to the fact that there are foundational things, again, that are going to be relevant no matter the context. Things like leadership and culture, which we've talked about, things like needing to engage patients and communities in the kind of work you're doing, the workforce safety piece, which I described earlier, where if you don't have a safe workforce, you can't take safe care of patients. Those things, that doesn't change if you're in a developing country or a developed country, or east versus west. Those are things that are going to be important throughout. Now, the specific strategies and tactics may differ, and that may have to be context specific. But I think those universal things are still pretty consistent across the board, and it's exciting to see that that this kind of work is happening really throughout the world, and not just in the U.S., and that we have a lot that we can learn from how other countries are approaching these problems as well.
Yeah, absolutely. A lot of times in America, we have that mindset that, if we're doing it, then everybody else should adopt it, but there's so much that we can learn.
Absolutely.